Welcome to Altea Talks, the brand new podcast series being brought to you by Altea, the unique provider of combined insurance and risk management solutions designed exclusively for the medical, allied health and care sectors. I'm going to be your host, Will Marshall, and I'll be joined in this series by some of the leading movers and shakers from across the sectors. My guests are going to include practitioners and professionals, regulators, clinical risk and governance specialists, and an array of legal experts who are going to help us get to the heart of the hottest topics affecting the UK's health and social care sectors today. So, if you're looking for frontline knowledge and expertise, if you want valued insights into these most dynamic, challenging and rewarding of sectors, then look no further because you're in the right place. Welcome again to Altea Talks. Hello and welcome to our latest edition of Altea Talks. We're here today to talk about the critically important and topical issue of artificial intelligence, and more particular about the increasing prevalence and importance of AI to the health and care sectors. It seems that the need for AI in healthcare has never been more keenly felt. Against a backdrop of a growing and aging population, staff shortages, an ever-increasing number of patients with complex needs to care for, the UK healthcare system increasingly gives the impression of a service that is struggling to keep pace. It's not surprising against this backdrop that increasingly we're seeing healthcare commissioners, policymakers and providers turn towards AI as representing a critical partner to help people take better care of their own health and to enable professionals to do what they do best. But as with all opportunities, there comes risk. And the introduction of using computers rather than, or more accurately, alongside doctors to provide care is not something that is going to happen without its own challenges. To help us navigate some of these issues, I'm delighted to welcome on today's episode Rachel Phillips. Rachel is the GB Health and Social Care Sector Leader at WTW. She has enjoyed a very distinguished career in the insurance industry, where she has worked for the world's largest brokers, as well as for medium and smaller firms. Rachel's various insurance roles have included risk management, underwriting, servicing, placement, project management, sales, and team leadership. During her hugely impressive career, Rachel has worked closely with many health and care organisations and sectors. Her clients have included profit and not-for-profit charities, healthcare providers, care homes, NHS Foundation trusts, life science providers and medical device manufacturers. Rachel is a chartered member of the Institute of Risk Management, and her passion is to support her health and social care sector clients to find a smarter way to manage their risks. Rachel has created numerous solutions and insights that have supported her clients to closely align their risk mitigation and wider strategies. Rachel has also authored and co-authored numerous articles for the health and care sectors. She has a particular interest in the use of artificial intelligence in healthcare and is a leading authority on the management of AI risks within the sector. Welcome, Rachel, to Altea Talks.
Thank you, Will. Delighted to be here.
So, Rachel, I think if we start at the beginning, what do we mean when we talk about artificial intelligence in healthcare?
It's a good question. For me, it refers to the way in which healthcare providers are increasingly utilising technology to augment and enhance their service provision by gaining better insights around patient care and also to improve efficiency. So improve wait times, better use of resource, ultimately to improve the patient journey and the outcomes.
Yeah. And can you give me some examples of how AI is being used now within, say, the NHS or within UK healthcare as of today?
Typically, we see AI being trialled or used in diagnostics and detection of disease, management of chronic conditions, and drug discovery, as well as healthcare delivery. So some examples might be the analysing of X-ray images, for example, mammograms, to support the radiologists in making assessments, perhaps supporting people in virtual wards. There's a real pressure and push to have care delivered at home and delivered in the place where people are most comfortable. So the increasing use of AI to deliver treatment in people's own homes, or, for example, remote monitoring technology and medical devices. And they can assess people's health and care quite simply while they're being cared for at home. And also another example might be brain scans. We're seeing the use of this in brain scans, so they can be read more quickly, and it shortens the time between the patients having their diagnosis and being treated. So better quality of care.
Yeah, thank you. That's very interesting. I think, we hear a lot about the importance of coupling AI models with expert human judgment to achieve, say, a higher diagnostic accuracy than either physicians or AI could manage by themselves. And it does seem that it's not going to be a matter, or is a matter, of one replacing the other. It's the joint intelligence from the human expert and the AI that counts. So if we sort of break that down a bit, how can AI augment the expertise of the providers, of the doctors and the nurses and the clinicians and so on, and support their decision making?
You've hit on the point. This is about augmentation. It's not about replacement. Absolutely. And looking at the diagnostic side, AI has shown some really promising results, actually, in detecting conditions quite early, such as pneumonia, breast cancer, skin cancers, eye diseases, for example. What it does is enable the practitioner to interpret the results, and it often will pick up sort of nuances that the human eye perhaps wouldn't have picked up. So it is about working together collaboratively. So importantly, the clinician remains the person interpreting the results and setting the treatment plan, although AI can contribute towards what the treatment plan might look like. So I guess simply put, AI is a second pair of eyes. And we're seeing this again in domiciliary care, because the ability to use data to help prevent or detect actually likelihood of falls and hospital admissions can enable the providers to make quite early informed decisions about individual care needs and whether they need to intervene or escalate to other agencies. So it's about working in tandem.
I think that's really interesting, because there's a lot of noise around the clinical and operational benefits of AI, but I suppose the way that it can really make a difference is by empowering people, patients, service users to take care of their own health and well-being. And in the wake of the pandemic, it seems to me there's an increased recognition that keeping patients healthy outside of hospital represents the future of healthcare, really. And there's been a shift towards a more holistic approach across the care sectors, with an increased emphasis on healthy living, disease prevention, and reducing avoidable hospital readmissions. And so that's another way, isn't it, that AI is going to be very important, or already is?
Absolutely, absolutely critical. And it's the direction of travel. There's scarce resource and huge pressure on the resource that we have, even in globally, never mind just in the UK. So anything that can be done to improve operational efficiency and to enable care to be delivered in different settings. And that prevention piece, I think, is really important as well. So helping with that early detection and helping us as individuals take ownership of our own health is really quite critical, I think, to this, and how AI can actually be embedded within healthcare.
Yes, and I suppose a further way is that we are experiencing, or we have been experiencing, an explosion of patient data. And there is now so much data out there as a result of the electronification of records and so on, that it risks becoming overwhelming, that siloed, different systems don't talk to each other and so on. So AI can also improve operational efficiency as well, can't it?
Absolutely. I mean, there's many examples of where it can help operationally. You've touched on workforce shortages, of course, and the ability of AI to address this in terms of speeding up the diagnostics. So we talked about radiology, to help reduce scan times and also produce higher image resolution, means that so many more patients can be scanned every day with increased diagnostic confidence. So that overall improves the patient experience. But also think about things like predictive maintenance of equipment, medical equipment. So to prevent avoidable and really frustrating and costly disruptions is going to be key. And to forecast and manage patient flow. So think about everything from admission through to discharge and ensuring the right care gets delivered in the right place. So that's, I think, going to be increasingly important. And then, of course, you've got the management of repetitive, some people say mundane, but important tasks, and at the same time, reducing the error rates, I think. So, and of course, that has the ongoing, hopefully, benefit to reduce caregiver burnout and also to enable caregivers to be giving care to the service users, to the patients. So it frees them up, actually, to spend more quality time where they need to.
Sounds great. I guess the next question then is, what are the ways that AI is likely to be scaled? How do we go about scaling the use of AI in healthcare? And it seems to me that presumably the first thing, as with any new technology, is that it has to be genuinely useful to the people who use it. And that seems to me for them at both ends of the spectrum. So the people who are working with it, but also the patients and service users who are hopefully benefiting from it. Are you able to give us some ideas, some comments around the ways that it is being scaled and what you think are likely to be those developments?
I think you've hit on one of the points. It has to be useful, so not used just for the sake of using it. And I think we're increasingly seeing the use cases coming forward, but it's also got to be trusted. It's got to be trusted by the service users, but also by the employees in health and care, so that it's going to produce the results and support in the way it's expected to. I guess regulation comes into this in terms of scaling and enabling, again, with that trust and that ability to it to be used for its intended purposes. And I guess the data sets are going to be critical to this, because even in the UK with the NHS, there are multiple different data sets. And actually, the interoperability of them isn't always as fully functional as we would like. So again, getting the data, if it's going to be scaled, that data accuracy is going to be important. And AI, to a certain extent, starts to self-learn as well, which can be good and bad, as we'll talk about later on, no doubt. And I think making sure as well that it's personalised, thinking about the things that are important to individuals is that personalised care. And I think you touched upon this. COVID has accelerated this. We have an expectation that we're going to have much more digital and personalised care in the same way that we go to the bank or buy the shopping in much more digitally enhanced ways. So for me, I think that's important. And I guess also just thinking about scaling up, where you could think of a use case around public health. You might see that AI comes into play in things like early detection of infectious diseases, to use an obvious example, but also other epidemics, so water contamination possibly. So again, and that actually represents quite a significant number of hospital admissions in the UK alone each year. So I think about 6.5%. So just thinking about it, it's the scalability of it. I think they've got to get some fundamentals working, but ultimately it's out there. I mean, it's very prevalent in health and care. So it's sort of scaling as we speak.
Yeah, absolutely. And I think just to pick up on one point that you made and one word that you used really is the word of trust. And obviously the AI generally has issues concerning public trust, and AI in healthcare involving the use of such sensitive personal data. There's obviously a key priority to strengthen public and professional confidence and trust that it's being used properly and that there's appropriate governance around it. So I think that sort of leads us quite nicely on to the sort of regulatory framework around AI, and maybe start just by saying, if you could give us a little bit of insight as to why regulatory frameworks and guidelines are so important when it comes to the use of AI in healthcare.
That's, again, another interesting point, because I guess regulatory frameworks and the guidelines around them have a crucial role to play, because we need to ensure that AI is being governed and used responsibly. And in that way, we will help with the trust to increase the adoption of safe and effective and actually value-added AI to improve service delivery and patient experience and outcomes. So I think it's important that for the service user, the patient, us as individuals, to feel that there's some governance, some line of sight over what's happening. And what we're seeing actually across the world is that governments and different organisations are all in different places, but actively working on establishing these standards and frameworks so that AI can be implemented ethically and safely.
Yes, we will come on to that then, because there is a bit of daylight, isn't there, between, say, the UK government's proposed regulatory approach to the opportunities and challenges of AI and that of the EU. So maybe if we could talk first more generally around AI widely rather than within a healthcare specific context, what is the UK government's proposed regulatory approach to the increased use of AI?
So the UK's approach actually is, and they've been quite vocal actually about wanting to be a leader in AI. As you might recall, last year, they were happy to be the first country to host an AI conference,
at
actually.
Bletchley Park.
Absolutely.
Yeah.
And not obviously deliberately, I would assume. But the government's approach in the UK is emphasising voluntary compliance, not surprisingly to us in the UK, I guess, but also importantly using existing law and regulators. And I think there's reasons behind that. And I think that one of them is for speed, probably. I don't know that, but for sure, but I would imagine for speed. And actually what we saw last June in the summer was a multi-agency partnership, the AI and Digital Regulation Service form between NICE, CQC, the MHRA and the NHS Health Research Authority. And that was to support the development and adoption, particularly in healthcare, of AI and of data-driven technologies.
That's interesting. And I guess the sort of the wider, less prescriptive approach that the UK government is endorsing is one that is sort of underpinned by wider principles about things like safety and security and transparency and redress and things like that.
Absolutely is. And I guess they're thinking that sort of voluntary principle-based regulation that they have and laws they have in other areas is the right process to follow with guide rails and guidelines. So, and I think we'll start to hear more on that, but they certainly seem to, I think they want to move quickly, which I can understand. And I think they need to move quickly from the trust perspective. So that may be behind it.
Yeah, it's as ever, a sort of delicate line to tread, isn't it, between having sufficient guidelines and safeguards, as you say, in place to maintain public trust, whereas not stifling innovation and opportunity. And I suppose that leads us on quite nicely to the EU and the EU's proposed AI Act. And how does that approach differ from the UK approach?
Well, fundamentally, the EU's taken a risk-based approach, and they're looking to introduce stringent standards for high-risk, particularly high-risk AI systems, effectively introducing new law. And I guess, again, you would sort of expect that maybe. That's not against the direction of travel generally for the EU. So more to come on that. And we hear more about it almost on a monthly basis about regulation. So, but at the moment, that's the fundamental difference between the two.
Yeah, okay, that's very helpful. And in terms of the way that healthcare regulators are addressing it, you did touch on it earlier, but say, for example, the MHRA guidance on software and AI as a medical device. Are you able to comment around that and sort of shed some light on where we are with that?
Well, I don't know their guidance in detail, but what they're trying to do is to help ensure regulatory requirements for software and AI are clear and that patients are protected fundamentally. And what you can see, therefore, is they're introducing and help in their definitions that AI and software are involved in as a medical device. That's what I see that's coming through there. So broadening existing guidance to make sure that it's adopted, but it's all about patient protection for them and to make sure there's, again, that guidance. There's hopefully little room for error.
And it's moving fast. It's evolving, as you said, almost on a monthly basis, and one that we need to keep a close eye on. And I mean, that leads us on to our next section, really, because regulation and governance is clearly important because of the risks involved with AI in healthcare. But when we talk about the risks, what do we mean? What are some of the key risk factors that healthcare organizations need to take account of in order to promote the safe and ethical use of AI?
When I talk to healthcare organisations, it's about being clear about understanding what AI can and cannot do. And actually, to a certain extent, staying behind AI. In other words, what I mean by that, making sure you've got the problem you're wanting to solve and then introducing AI rather than just, well, we must have some AI. We must bring AI in. So, but performing due diligence in key areas, I think, is critical. And you've touched upon some of this as we've gone through. So given that AI, certainly the large language model AI, generative AI, is based on data sets, significant data sets which they draw from, that can lead to biased decision making. And of course, the one thing AI isn't, you touched upon this right at the outset, it isn't human. So it doesn't have the human ability for compassion or to actually look at other factors in many ways. The World Health Organization, interestingly, in a report, I think it was a report from last year, highlighted the challenges as well around this biases that were sort of encoded, if you like, in algorithms, but also think about unethical collection and use of health data. And you've got things like risk to patient safety and also cybersecurity more broadly, because actually AI can be hacked in the same way. And you've got a lot of very personal information in healthcare. You can have things like risks around deep fake. We've seen this with IT, and that's obviously a risk. Introduce technology, you've got that potential. But also it raises a lot of concerns, I think, for employees around their job security due to increased automation. Back to the point you made earlier, this should be seen as working in partnership, in tandem with humans and not one or the other. I think I talked about the validity, I guess, of the data in light of historical data and the massive data sets that the AI needs in order to learn. And you'll need to perhaps there may be a risk around seeking assurance around historical patient data. And I guess the other thing for me is making sure that there's effective training of employees. Well, training of employees, but also understanding for the service user about what the AI is going to do for them and what it's not going to do for them, educating your people. And there will be some distrust. I think it was Harvard Business Review issued a report which said that in the US, actually, that there was AI being used for cancer detection. And despite it being significantly better at detecting cancer earlier than the clinicians, patients still didn't trust it. And that was quite interesting. And that's because they felt that the human nuances, the human part of that doctor-patient relationship was missing. So there's a risk there that you will lose your sort of service user, the patient, the individual, and lose their trust, which actually can impact them and also impact your employees for the same reason around their mental health, their well-being. And of course, that further compounds from an employee perspective, workforce challenges. So I think there's many risks around the use of AI, the adoption to build the trust, and also to make sure that you've got the data that you think you've got and then keep it safe, if I could sort of summarize.
Yeah, no, that's really helpful. Thank you, Rachel. What sorts of risk mitigation strategies and policies should healthcare providers be looking at if they're seeking to implement AI, really to sort of mitigate some of the risks that you've talked about and to ensure patient safety?
There's, I guess, a few things. These aren't going to be new. They're just about bringing risk management in, using AI as another form of risk, as we've said. So how do you manage it? So I guess initially establishing the right policies and procedures for the AI applications and devices. And that would include embedding any ethical concerns within the system development in the first place and guide rails for using AI responsibly. I think building review, multidisciplinary review actually into AI as well is important. So before you implement a new AI-enabled product or service, a multidisciplinary team, including end users, would be useful to review and to help guard against unexpected outcomes. And then build in the systematic testing for failures. So make sure you understand the potential modes of failure and any impact they might have. And then I talked about this earlier, invest in training. So as it becomes more integrated, ensuring the workforce is adequately trained and educated, and that's absolutely essential. Checking staff understands the capabilities and limitations of AI, and also to enhance, not just to manage risk, but also to enhance the effectiveness actually in providing the quality care. And that could be things like training checklists, educating teams on escalation strategies if they've got concerns over the integrity, and also when injuries occur. And moving on to that, another management of risk is monitoring and recording of incidents, including, importantly, routinely tracking and trending all AI-enabled incidents that could, as well as did, cause harm, and ensure that the care teams understand the process of reporting through such incidents, including, for example, to the regulators where appropriate. Just three more quick things, really. Include privacy requirements. It sort of goes without saying, hopefully, but embed those with any contracted AI vendors as well. Make sure the contracts have the privacy requirements, and continuously monitor and record the accuracy of the systems afterwards, particularly around measuring how accurately AI outputs match clinicians' choice of action, because we're increasingly seeing AI start to be a roadmap in a way for treatment plans. So seeing how well that matches, I think would be very useful. And then lastly, review your insurance, sort of consider.
I thought we'd come on to insurance.
Consider how adopting AI technologies could impact your risk profile and engage with your insurers or your brokers to make sure that the implications are reviewed and you know how your policies might respond in the event of an incident.
Yes, and I think just sort of building on that point, it's very important if you are making material changes to the way that you are operating and providing your services, that your insurers are made aware of those.
And come along on the journey with you. I agree.
Yeah. Which brings us neatly on to the issue of legal liability. And perhaps the first point to make on that really is the potentially very wide range of legal issues associated with the use of AI in healthcare. Perhaps the best known of these, or certainly one of the most widely commented on, is who is going to be responsible in the event of harm being caused to a patient as a result of AI. But I think if we dial it back from there, obviously there are really very significant legal issues surrounding the use of the data that's needed to build this kit in the first place. And given the very sensitive nature of the patient data that is being trained for these purposes, I think we're obviously seeing a lot of noise at the moment around the information governance issues, data protection, confidentiality, the whole question around equalities, discrimination, and bias, and the need for this data to be fair and transparent, but still to be anonymized, and really to make the data as broad as possible, which of itself is often a challenge, given that I believe the NHS has said that anonymizing data can itself be considered to be processing for data protection purposes if that data is not being used for the direct benefit of the patient. So that could give rise to the need for explicit consent from patients to have their data used, and that in turn can give rise to further issues around bias and so on. There's then the whole question around regulation, and I am very conscious that there is a lot going on in that space. We've had the EU's AI Regulation Act, we've had the further developments following the Bletchley Park event last November and the follow-up event in Korea, the discrepancy between the EU approach to regulation and that of the UK and the US, and so on. I think that really is a whole topic for another day. So I think, Rachel, I'm going to ask if we can have a look at that again, maybe later in the year when that particular process has evolved a bit. And then we get on the legal side of things to what happens in the event of harm to a healthcare user as a result of AI being involved in their treatment or care. And I think when we get into that, we're really looking at the extent to which the current clinical negligence legal framework under the Bolam test would still be applicable. And really the questions then rise as to, who is going to be liable for this? Is it going to be the liability of the doctor? Is it going to be the liability of the developer? Is it going to be a liability of the entity that has procured this? And I think you can see already the scope for a whole range of satellite litigation around things like products liability, IP, procurement issues, and so on. So I think that what we can safely say perhaps at this stage, all we can really say at this stage, is that it's probably going to make litigation more complicated. It's probably going to lead to an increase in the number of defendants, the number of parties to a particular claim involving AI where something's gone wrong. And there's going to be further apportionment issues. And really, I think, it would be remiss just to focus on the implications for litigation, because just thinking about things such as patient safety investigations, they're also going to become more complicated when it's necessary to consider the role of not just the clinicians or the hospital, but also of AI and the AI providers and developers, and also handling complaints and so on. So I think it really is a potential can of worms on the liability side. As I say, I think it's a whole further podcast of itself, but the best that I can say about it really at this stage is let's just watch this space and see how things evolve and develop in what is undoubtedly a very interesting area.
I think there will be a duty of care, of course. But I see that continuing with the clinician at the moment. If you can use AI to get early warning prevention, which is really where healthcare needs to go, and whether that's at home or in a hospital setting, whether we're taking more responsibility for our own health, which we are seeing increasingly, as we've said, I don't think we'll ever lose that clinician, or certainly not in the short term, lose that clinician interpretation and the human compassion and understanding of all the other factors. And I think that might therefore help avoid those sort of scenarios or discussions.
Yeah, I agree with that. But I think that looking a bit further ahead, if we are sort of getting into tomorrow's world with AI actually sort of replacing or doing the job that doctors are doing in terms of diagnosis and so on, the way that I see it going, and we're all crystal ball gazing here, none of us knows, but the way that I would see it more logically going is perhaps an expansion of the non-delegable duty route, so that ultimately the patient would have recourse against the hospital or the clinic that has decided to use this kit, and then it would perhaps be a sort of secondary litigation for the hospital or the clinic. Anyway, it sounds like it might be a bun fight for the lawyers.
It could be quite interesting, actually, and whether there'll end up being any strict liability, I don't know. I mean, I think one of the things, that the uses of AI is in robotic surgery, of course. So if you take that to its natural conclusion, you're not wrong. Ultimately, is it the robotic equipment or the surgeon that, again, so it'll be interesting to watch this space, I think.
I think so. And I think there are sort of other issues as well. I mean, looking a bit further into the future, will there be a duty to use AI? If AI becomes the gold standard, what will be the duty to use it? And if we're looking at things like, say, for example, the McCulloch decision on consent from last year about reasonable alternative treatments, is there going to be a potential liability for healthcare providers who don't have this equipment, but it's available down the road? So I think it is a real can of worms.
To that point, Will, as well, when you talk about consent, is if the service user, the end user, the patient, doesn't understand what's coming from, where the information came from to detect and give the diagnosis, and how can they make an informed consent as well around treatment. So I think that's going to be interesting to watch. I think we're going to watch that space with interest. But I think if you just look at the significant increase in AI and its ability to transform healthcare globally, which is badly needed, I think it's clear it will become commonplace, and it will just be, rather than a duty, it will just become part of our norm.
Are you able to sort of give an overview of the sorts of impacts that the wider use of AI in healthcare can have firstly for providers and for hospitals and clinics and doctors?
Yes. Well, I guess what I would see, and this again is just my view, is that it's going to enable them to provide much more personalised, individual patient-centred care, which is what they want to do. So I can see that that's how AI is going to really support them. I think it's going to help resources and allocation of resources by enabling more treatment at home, as we've talked about. And I think it's going to enable the clinicians and the specialists to really focus on that quality of care. And I think that's the critical thing. So it's, we know there's a lot of paperwork, there's a lot of really important information that has to be gathered. If you can automate that and have that dealt with, and they can then spend their time on the quality elements of that, that's going to be better for everyone. They're going to enjoy their roles more and giving better quality of care. And the end user's going to get a better patient experience, better quality of care.
And that would lead me on to the second part of that rounding up question, is really what the benefits are for the end users, for the patients, where you see those benefits coming through and what those are likely to look like in the next short to medium term.
Well, again, coming back to the point raised earlier, I believe as individuals, we're going to be able to go from reactive treatment to more preventative care, which is really important. So it's got to be better for everyone to have earlier detection of some of these diseases. And if let's take sepsis as a great example at the moment, and it's a horrific disease that causes significant number of deaths globally. If you could detect those signs, and we're starting to see AI coming into all this detection, spotting really early signs of heart attacks and also neurological conditions. So it's not beyond the wit to think, and there's possibly even research and development ongoing now, to think if we can detect sepsis and conditions of that ilk, we can help prevent them. Okay, so certainly in terms of patient care and patient quality of information, they'll be hearing about things earlier. So that for me is, and that prevention and help, I think, is going to be greatly appreciated. But I think also being able to have care more locally delivered is better for the end user, but whether it's at home or somewhere much more local, I think we're all going to appreciate feeling that you're going to get quality time off your clinician and you're actually going to have better interactions with them that are higher quality. And hopefully you won't be faced with, as we often are in the NHS, a workforce that just looks shattered when you're there, which doesn't, give you confidence. So I guess if we can build that trust, ultimately, as end users, we're going to have much better experience. So ultimately, it's going to have to be, if it's going to be driven, it's going to have to be about the end user experience, the quality of care, ultimately. And if you look at the UK, an NHS that's working for everybody, still free at the point of use, which is what everyone loves.
Yeah,
I guess.
Yeah, absolutely. We are both employed in the insurance industry, and I think it would be remiss of us not to focus our attention to those implications briefly. So what sort of impacts could the wider use of AI in healthcare, in your opinion, have for insurers and for indemnity insurance?
This is definitely occupying insurance minds currently, as we know. For me, the greatest impacts are around how we fully understand and quantify the risks presented by AI, firstly. So once we have that information, then how should relevant insurance policies such as medical malpractice, professional indemnity, cyber, for example, respond in the event of an incident? And lots of discussion is ongoing about this. And I expect to see an increasing convergence of the relevant policies, forming a combined policy so that you can avoid gaps and arguments between insurers about who's responsible, who's on the hook for any particular claim. And I think the other point is around indemnity, depending on, we talked about the legal ramifications earlier, depending where that goes. I think if you just looked at the limits of indemnity, one of the things I think is we need to review the limit deployed, particularly when you have aggregation of limits that apply, so that you ensure there's sufficient cover should the worst happen, because of this, just the nature of technology. And you can just sort of think about the ability for that to be applied to multiple service users. I think that the limits of indemnity may well need to be looked at. But I think the biggest change is going to be fully understanding, fully quantifying, and then converging the policies around the risk.
Yeah, move away from the sort of siloed towers of cover that we see commonly now. Yeah.
I hope so, because I think the end users, so whether the healthcare providers, I think are going to appreciate that. I think that's what they're going to be looking for, rather than try to shoehorn AI into all the different lines of cover, sort of wrap a cover around AI. I don't see an AI policy like you see a cyber policy, just to make that very clear. But I do think that the policies sort of need to wrap around a healthcare provider for however they deliver care. And AI might be one of those.
That goes back to your earlier point about the importance for healthcare providers of taking their insurers with them as their services and provision evolves.
Yes, and not just assuming that insurers should understand that they're involved in that. It does change the risk profile somewhat. And it's important, I think, that insurers engage with that. I mean, ultimately, as a healthcare provider, you want the policy to respond as you expect in the event of an incident. So therefore, having those early discussions and with insurers are critical. But I think it also will enable insurers to build the right policy wordings to give you the protection that's required as well.
Yeah, interesting times. Rachel, I'm conscious that we've been talking for some time. I'm sure we could talk for a great deal longer about this fascinating topic, but I think we'll leave it there. It just remains for me to thank you again for appearing on Altair Talks and for sharing the benefit of your wisdom and your experience with us. It's been really fascinating talking to you this morning, and I'm very grateful to you for your time. Thank you so much.
Thank you, Will.
Thank you for tuning in. I hope you enjoyed today's episode of Altair Talks. If you did, please don't forget to subscribe or leave a like or a review on whatever platform you're listening on, as this helps spread the word. If you have any questions or comments or topics you'd like us to explore in future episodes, please do contact us, as we'd love to hear from you. You can find us on LinkedIn or visit our website at www.altairinsurance.com. Stay tuned for more episodes, and until next time, take care of yourselves. The information contained in this podcast is not intended to represent a complete analysis of the topics presented and is provided for information purposes only. The views expressed are personal to Rachel Phillips and Will Marshall and do not necessarily represent the views of WTW or Altair Insurance. The content of this podcast is not intended as legal or specific risk or insurance advice, and no responsibility can be accepted for any reliance placed upon it. Independent legal, risk, or insurance advice should always be obtained before applying any information to particular circumstances.